Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we're going to be talking about fats in our series on nutrition. So to start this episode, we're going to go over what are fats. So in nutrition, biology, and chemistry, a fat usually means any ester of fatty acids, or a mixture of such compounds, most commonly those that occur in living beings or in food. So the term often refers specifically to triglycerides, or triple esters of glycerol, that are the main component of vegetable oils and of fatty tissue in animals. The term may also be used more broadly as a synonym of lipid. So that's any substance of biological relevance composed of carbon, hydrogen, or oxygen that is insoluble in water but soluble in non-polar solvents. And fats are one of the three main macronutrient groups in the human diet.
And then we'll go over a little bit of the physiology of fats. So, pancreatic lipase acts at the ester bond, hydrolyzing the bond and releasing the fatty acid. In triglyceride form, lipids cannot be absorbed by the duodenum. Fatty acids, monoglycerides, which is one glycerol with one fatty acid, and some diglycerides are absorbed by the duodenum once the triglycerides have been broken down. In the intestine, following the secretion of lipases and bile, triglycerides are split into monoacylglycerol and free fatty acids in a process called lipolysis. They are subsequently moved to absorptive enterocyte cells lining the intestines. The triglycerides are rebuilt in the enterocytes from their fragments and packaged together with cholesterol and proteins to form chylomicrons. These are excreted from the cells and collected by the lymph system and transported to the large vessels near the heart before being mixed into the blood. Various tissues can capture the chylomicrons, releasing the triglycerides to be used as a source of energy. Liver cells can synthesize and store triglycerides. When the body requires fatty acids as an energy source, the hormone glucagon signals the breakdown of the triglycerides by hormone-sensitive lipase to release free fatty acids. As the brain cannot utilize fatty acids as an energy source unless converted to ketone, the glycerol component of triglycerides can be converted into glucose via gluconeogenesis by conversion into dihydroxyacetone phosphate and then into glyceraldehyde 3-phosphate for brain fuel when it is broken down. Fat cells may also be broken down for that reason if the brain's needs ever outweigh the body's. Triglycerides cannot pass through cell membranes freely. Special enzymes on the wall of blood vessels called lipoprotein lipases must break down triglycerides into free fatty acids and glycerol. Fatty acids can then be taken up by cells via the fatty acid transporter. The human body can produce the fat it requires from other food ingredients, except for a few essential fatty acids that must be included in the diet. Vitamins A, D, E, and K are fat-soluble, meaning they can only be digested, absorbed, and transported in conjunction with fats. So now that we kind of know a little bit about what happens to fats when we eat them, are they important? They are, as most things are. They are a major and dense source of food energy for many animals and play important structural and metabolic functions in most living beings, including energy storage, waterproofing, and thermal insulation. They play a vital role in maintaining healthy skin and hair, insulating body organs against shock, maintaining body temperature, and promoting healthy cell function. Fat also serves as a useful buffer against a host of diseases. When a particular substance, whether chemical or biotic, reaches unsafe levels in the bloodstream, the body can effectively dilute or at least maintain equilibrium of the offending substances by storing it in new fat tissue. Bad fats such as margarine, shortening, and hydrogenated oils are known or have been known to cause cardiovascular disease and other health issues. And then there are good fats, which are like avocados, almonds, olive oil, have been shown to prevent disease and benefit well-being. And it's important, as with anything, to just make sure you're using in moderation. And it's, if you can, good to choose those good fats over the bad fats. And trans fats, the FDA actually banned trans fats in 2018. They ruled that trans fat was not generally recognized as safe and could no longer be added to food after the 18th of June of 2018, unless the manufacturer could present convincing scientific evidence that a particular use was safe. So for the most part, they are banned, but it's, I would say it's not, you can still keep an eye on it. Just because supposedly if a manufacturer can present evidence that it is safe, then they can still use it, which I don't, okay, but whatever. For the most part, they're banned.
So we'll talk about omega-3 fatty acids next. So what are omega-3 fatty acids? Well, they're crucial to mental health. So 2 omega-3 fatty acids, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, are thought to have the most potential to benefit people with mood disorders. So cold water fish like salmon, mackerel, sardines, tuna, shellfish, herring, and I guess sardines twice. So these fish contain EPA. And cold water fatty fish like salmon, herring, sardines, shellfish, and especially tuna contain DHA. There are different mechanisms of action that have been proposed. One of these is that omega-3s are able to interact with mood-related molecules in the brain after easily traveling through the brain cell membrane. Their anti-inflammatory actions also may help relieve depression. Out of the multiple clinical trials testing different omega-3 preparations to treat depression, most of them use it as an add-on therapy for people on prescribed antidepressants that have limited or no benefit to the patient. So few studies examine omega-3 treatment alone. These studies typically either use EPA alone or combine it with DHA, using doses equivalent to eating 3 meals with salmon per week. So to be most effective, these preparations have to have at least 60% EPA relative to DHA to be the most effective. And the most effective preparations appear to have at least 60% EPA relative to DHA, but while DHA is seen to be less effective as an antidepressant, it may be more protective against suicide. And specifically, overweight patients with elevated inflammatory activity are particularly good candidates for EPA treatment, according to Massachusetts General Hospital and Emory University. And because of variability between doses and the ratios of EPA to DHA conducted, along with other study design issues, findings on this are not unanimous. So various mood disorders such as postpartum depression, bipolar disorder, schizophrenia, borderline personality disorder, obsessive compulsive disorder, and attention deficit disorder. Omega-3s have been studied on these, and some studies point to benefits for patients with these disorders. So the testing on postpartum depression has shown really promising results. While with bipolar disorder, omega-3s are beneficial for dealing with depressive episodes, but not the manic episodes. So when used during manic episodes, the symptoms can actually be exacerbated with omega-3 use. And while studies look promising, there is not yet enough evidence to suggest the use of omega-3s in these conditions. However, the ability to use these treatments is, of course, the choice of the patients, although it's recommended to always talk to your doctor about these things first. Typically, omega-3s are tolerated well and safe to use. The most common complaints are of upset stomach and the fishy taste. Although thanks to manufacturing methods that reduce impurities, these are less frequent than they previously were. So while caution is still advised for patients using blood thinners or people about to undergo surgery, past concerns about the increased risk of bleeding have largely been disproven. And omega-3s are important to brain development. Because pregnancy can deplete omega-3 in expectant mothers, it's thought that taking omega-3 supplementally would be beneficial, and fish consumption in pregnancy is supported by the FDA. However, because long-term data on safety and most efficient dosage of omega-3s in pregnancy doesn't exist, expecting mothers should consult their doctors and be cautious about taking omega-3 supplements. So omega-3s are important for normal body metabolism. They're a vital part of cell membranes and provide the starting point for making the hormones that regulate blood clotting, contraction, and relaxation of artery walls and inflammation. They are essential fats, meaning we must get them from our diet. So 3 main omega-3 fatty acids are alpha-linolenic acid, ALA, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. So EPA and DHA are the 2 omega-3s that play the most critical role in mood disorders. And omega-3s promote brain health by lowering inflammatory markers and protecting neurons from excessive inflammation.
And then we're going to go a little bit more into how fats can affect mental health or mood. So we'll start with depression again. So consumption of fried foods has been linked to depression, and consumption of trans fats has also been linked to depression. MUFAs, which are monounsaturated fatty acids, and PUFAs, which are polyunsaturated fatty acids, have been shown to help decrease depression risk. Olive oil, which consists largely of MUFA or MUFA, has been shown to significantly lower depression risk. And studies have shown that people who consume foods high in omega-6 fatty acids have more than 4 times the risk of depression compared to those who consume foods high in omega-3s.
So let's look at anxiety for a second. Omega-3 may help alleviate anxiety, and a higher ratio of omega-6 to omega-3 has been linked with higher levels of anxiety. So coconut oil, lard, butter, olive oil, and palm oil are all relatively low in omega-6 relative to omega-3. Meanwhile, cottonseed oil, corn oil, soybean oil, and sunflower oil contain much higher amounts of omega-6 relative to omega-3.
And then we'll talk a little bit about inflammation. Omega-3, EPA, has been shown to help with inflammation. And how does it do that? It is thought to occur via anti-inflammatory and neurochemical mechanisms that affect the brain. It may occur via the brain's dopamine pathway. When the brain is inflamed, interleukin-1, an inflammatory marker, can increase dopamine levels in the nucleus accumbens, a collection of brain cells implicated in human anxiety. And studies have shown that omega-3s can suppress this effect in both animals and humans.
So now let's talk about sleep. Studies have shown that omega-3 fatty acids can help improve sleep, decrease inflammation and normalize sleep. They decrease inflammation and normalize sleep, and protect the brain from memory impairment in sleep-deprived mice. In a study, participants who received omega-3s experienced improved depression, less anxiety, and better emotional control. Over time, their sleep improved as well. Some fatty acids are precursors of prostaglandins, sleep-promoting substances in the brain. Other fatty acids contribute to the development of melatonin necessary for sleep, and they increase sleep efficiency and REM sleep.
And then we're also just going to briefly talk about diet here. Kind of just a couple of different things about diet. So the big thing is you want to maintain a healthy balance between omega-3s and omega-6. And unfortunately, the typical Western diet has more omega-6 foods, which is going to lead to disbalance. So eating in excess of omega-6 foods can trigger the body to produce chemicals that spike inflammation. And it turns out that most Americans need to cut down on foods high in omega-6 and try to eat more foods that are high in omega-3. So you may be wondering what those could be. I think we mentioned some before too, but we're just going to reiterate here because it's important to know. So foods high in omega-6 are full-fat cheese, high-fat cuts of red meat, corn oil, and palm oil. And then for omega-3, one of the best sources of omega-3 is fish. So that could be salmon, mackerel, tuna, herring, and sardines, as we mentioned before. And then I guess it also turns out that grass-fed beef contains more omega-3s than commercial beef. Alpha-linolenic acid, or ALA, is available from plant sources like edamame, walnuts, and chia seeds. So if you're thinking of maybe something that you could, so maybe something small that you could do is, instead of using just like regular vegetable oil, you could try using canola oil with cooking. And then one more thing here is from the NIH, National Institutes of Health, Office of Dietary Supplements, and it's a fact sheet for health professionals, but they also have one for consumers if you wanted to look at that one too, on omega-3 fatty acids. So I mainly just wanted to kind of go over recommended intakes, and then just there's also a picture diagram picture here that kind of shows some different foods with, and then the grams per serving of ALA, DHA, and EPA. But first we'll go over recommended intake. So intake recommendations for fatty acids and other nutrients are provided in dietary reference intakes developed by the Food and Nutrition Board of the Institute of Medicine. It is the general term for a set of reference values used for planning and assessing nutritional intakes of healthy people, and they vary by age and sex. And so, again, these are just the recommended. It may vary per person too, but so adequate intakes for omega-3s, you have, well, age is birth to 6 months, so that's going to be 0.5 grams for males and 0.5 grams for females. For 7 to 12 months, it's going to be, again, 0.5 grams per each. 1 to 3 years, it's going to be 0.7 grams for males and females. For 4 to 8 years, it's going to be 0.9 grams for males and females. For 9 to 13 years, it's going to be 1.2 grams recommended for males and 1 gram recommended for females. And then for 14 to 18 years, for males, it's 1.6. For females, it's 1.1. And then for pregnancy, it's 1.4. Lactation, they recommend 1.3. For 19 to 50-year-olds, for males, again, 1.6. Females, again, 1.1. And then pregnancy, again, 1.4. Lactation, 1.3. And then 51 years and older, males, again, 1.6. Females, again, 1.1. So it's, once you, 14 and up, it stays pretty consistent, which makes sense too. And then we'll just talk about some sources of omega-3s. So here's just a table, again, from the NIH. I'm not going to go through all these, but we can just look. So salmon, as we talked about, has 1.24 grams of DHA and 0.59 grams of EPA. I guess there's mayonnaise here, 1 tablespoon, that has 0.74 grams of ALA, but no DHA or EPA. Shrimp cooked, 3 ounces, has 0.12 grams of DHA and 0.12 grams of EPA. Then just, let's look at a chicken breast roasted, 3 ounces, that has 0.02 grams of DHA and 0.01 gram of EPA. So I think it's, again, just important to kind of know with every nutrition aspect we discussed today, just knowing what the recommended is and how much of each food, like what are good sources for those so that you can meet your recommendations. Because yes, there are supplements, but if you can, nutrition is always going to be better. Like getting all this from food is always going to be better than getting it from supplements, but supplements are always an option too. But you should talk to like a healthcare professional if you're thinking about supplements. And that was what we had on fats. So join us in the next video where we go over a little bit on dairy. And as always, you can leave a comment below if you have any topics that you want to hear us talk about in future episodes.
Yeah, you can reach out on Facebook, YouTube, Instagram, Twitter, and TikTok. We also occasionally live stream on Twitch, so you can follow us there to be notified when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts and turn on notifications so that you get notified when our new content comes out. Otherwise, we will see you all in the next video.